Sebastian Vidasis. I'm the program manager for the PASOs program. I lead a group of community health workers that are implementing the PASOs program in the system and implementing the Access Health program. Certified community health workers really help the system in bridging that gap because they're trusted members of the community, and having an evidence-based approach to community care is really important, and having certified community health workers within our system really enhances how we deliver care to our community. So the community health worker training really helps our community health workers in sharpening their skills on resource navigation, on educating our community members about their specific conditions, and helping them access the system and navigate the system more appropriately and efficiently. And it also helps our clinicians and our providers have a better understanding of our patients, because our community health workers are often communicating with providers back and forth through our electronic medical record system. Our community health workers really learn through the training how to have those conversations with patients, how to empower them to seek resources, how to empower them to be prepared when they go to the doctor's visits and have a productive visit with their providers. One of our community health workers here in the system, through the education that she received during the training, she was able to learn how to do a health fair. So during the training, community health workers learn and do a mock sort of coordination of a community event. So how to connect with partners, how to send emails, how to send text reminders for community members to attend the health fairs, how to do flyers. So that's put into practice when we as a system want to reach patients and invite them to health fairs that we do, to events that we do. We have a number of community leaders in our communities in the upstate. For example, in the upstate, we have a pool of volunteers that volunteer their time to come out to events, to support our teams and reaching out to the community. So having a funding structure or a source of funding for these community volunteers, these community leaders, to be able to obtain a formal education on community health work is really important, because it'll provide them with an opportunity to get a certification on how to reach communities in a structured way. So we have a really good leaders out in the community, and it's important to provide those opportunities for community leaders to access the certification training on community health work.